We're broadcasting. Hi, Megan.
Okay. Hi, Megan. Hi to those of you who are just joining us now. Just hang tight. We're going to wait until for a few minutes to allow people to log on. Greetings to those of you who are just joining us right now. Please just hang tight for a minute or two so we give everyone a chance to get logged on. Okay, we seem to be somewhat stabilized in terms of number of participants. I'm going to go ahead and get started. Greetings, everybody. For those of you who I haven't met yet, I'm Hilary Godwin, Dean of the UW School of Public Health. And just as a reminder that we are being recorded, and also another housekeeping issue that we use the Q&A function for answering questions, or if you have something that you want everyone to see for the entire time, you can put it in chat, like a link to an important resource. But if you have questions, please use the Q&A function as opposed to putting the questions in chat or using the raising your hand function. So just as a reminder, this webinar, which is our 9th weekly webinar during COVID, so it's been a long time already. This webinar is really geared towards people who have who are primary in the UW School of Public Health. So if I provide guidance about, workplace stuff or policies, I'm specifically talking about us in the School of Public here at the School of Public Health here at the University of Washington. So if you are a primary in another school or at another organization, be sure to talk to your supervisors or boss there to find out what the deal is. And so our plan for today is that we're going to spend the first part, me sort of providing an update on where things are with COVID, both worldwide and here locally, and then some updates for things that are going on here in the school. And then we will turn to our guest speaker. So our guest speaker for today is Marissa Baker. Marissa is an assistant professor in the Department of Environmental and Occupational Health Sciences. And she's also the director of the Industrial Hygiene program in our school. And her topic will be on worker health and safety during COVID-19. Once we have workplace restrictions lifted. So really timely topic, as many of us are thinking about return to work. So we sort of thematically focusing on that. There also was an email that went out just a little while ago, a couple hours ago, from myself and Jared Baton, our Vice Dean for Faculty Affairs and Strategy, about hiring restrictions. And so I'm guessing we're going to get a lot of questions about that during the Q&A period, which is what will follow Marissa's presentation. So I noticed we already have one question up there about the hiring restrictions, and we will get to you, but it'll be in that last sort of third of the webinar. The other panelists that we have joining us today are Janet Baseman, who's our Associate Dean for Public Health Practice and also Professor of Epidemiology. Lisa Manhart, who's an Associate Dean for Research and also Professor of Epidemiology. And Stephanie Farquhar, who's our Acting Associate Dean for Education and a Clinical Professor in Health Services and DEOHS. And I've also asked Megan Herman, who's our Director for Human Resources for the School of Public Health, to be available, and I see she's online, in case you guys have technical questions about hiring restrictions, particularly the staff-related ones, so that just in case I need backup. So Okay, so we'll start with the general update. So, this is, as everyone knows, has been an incredibly tough time for so many people, so many families, so many businesses. And we send out our condolences to all of those of you who have lost loved ones or have friends who have been ill or severely impacted by COVID-19. It feels like, some people were affected early on, but it's getting to the point where many of us know people who have lost their lives to COVID. And it's, especially so many weeks into this, is psychologically a challenging time for all of us. And making things worse, the pandemic has had just a devastating impact on the economy. And most experts are now predicting that we're heading to a recession that will be worse than what we experienced in 2008. The first official numbers of the impact on the nation's gross domestic product, a measure of our overall economy, came out today. And they show that the GDP in the U.S. during the first quarter fell at an annual rate of 4.8%. All expectations are that it's going to be worse this quarter. And experts are projecting that the economy will shrink by an annual rate of 30% or more this year, which is something that most of us have not seen in our lifetimes. Here in Washington State, jobless claims are at about 1 million. Nationally, unemployment applications reached more than 26 million last week, officially wiping out all the job gains that were made since the last recession. When combined with those who are unemployed before the pandemic, you get a total unemployment rate of more than 20%, which we haven't seen in this country since 1934. All of this means that many people are anxious to get back to work if they can, and our governor and many other governors are under increasing pressure to ease social distancing restrictions and allow some parts of the economy to reopen. So the big question that's on many of our minds is how we could do that in a way that doesn't jeopardize the gains that we've made in flattening the curves of this pandemic so far. So that's a big part of what we'll be talking about. Last week, we saw Governor Inslee agreeing to allow some construction work to resume. That is residential construction. We already had allowances for essential construction prior to that. That's with the caveats that physical distancing measures need to be maintained and that other precautions need to be taken. This week, the governor lifted some restrictions on outdoor recreation. I have behind me probably a site that many of you recognize from Discovery Park as sort of a celebration of, woo, we get to go back to the park. State parks and other state lands will be open for hiking, hunting, and seasonal fishing on May 5th. Golf courses will reopen for groups of 2 or even foursomes if everyone is a member of the same household. That being said, strict social distancing practices need to be followed, and public gatherings and team sports are still banned in our region. The governor's chief of staff indicated yesterday that Governor Inslee this week will extend his stay home, stay healthy order, which was set to expire on May 4th. And Secretary of Health John Weisman says the state is now looking at a regionalized approach where certain regions of the state where coronavirus levels are low could open before other areas. In Washington State, we're now approaching 14,000 total confirmed cases of COVID-19, including more than 780 fatalities. The number of tests that have been run in our state, we have some of the best testing capacity in the United States. We've had over 180,000 tests run to date in the state of Washington with an overall positivity rate of 7.6%, but that percentage, fortunately, is starting to come down. Sorry, that's not the overall rate, that's for this week. Last week it was, I'll have to check on that. Last week it was 8.5%, and the week before was slightly higher still. Okay, it's been 24 days since we hit our peak number of deaths for the state. That was on April 5th, and we've seen a significant drop in hospitalizations with the number of deaths per day ranging between 10 and 20 over the last 2 weeks here in King County. So that's all good news. That being said, a number of different modelers are looking at what we might predict if we started to release the social distancing measures that we have in place. And we got a strong message from the Institute for Disease Modeling last week that it's important that we continue those social distancing restrictions beyond May 4th, which is a big part of why Governor Inslee is now making that recommendation, and that we expect that to be extended. Worldwide, we've had more than 3.1 million total cases confirmed. And global deaths have surpassed 224,000. Nationally, we hit some somber milestones this week, more than 1 million cases in the United States alone, and more than 53,000 deaths. Many will probably be tempted to compare the number of deaths in the United States from coronavirus to the tragedy of the Vietnam War, when more than 48,000 Americans were killed. Although these comparisons are natural and a sign of the trauma that Americans are now suffering, it's important to recognize that, and often forgotten here in the United States, that more than 3 million civilians and soldiers from North and South Vietnam lost their lives during that conflict. Nationally, total deaths are projected at more than 72,000 at this point. That's an upward revision since last week from IHME. So we, I think I'm hearing from a lot of people questions about why the models are fluctuating. And so I've just offered, and I've been touching base with our own modeling teams who are doing different work. And some take-home messages are that there's not a lot of consensus among the models. Different people use different types of models and are modeling for different purposes. So if you're going to go for like, here's what we can expect, that to look for the areas where we do see consensus among the models, which seems to be that we need to stay the course for longer at this point, and that a lifting of those restrictions at this point would likely just result in immediate resurgence. So not great news, but still news worth heeding. There's some exciting news out of Oxford University about a possible new vaccine that could be available in 6 months. They had actually been working on another coronavirus vaccine for some time, so they had a bit of a head start. Meanwhile, we continue to learn more about the disease, such as the fact that it can cause strokes in people in their 30s and 40s who had mild COVID-19 symptoms. And then just some reports out of the United Kingdom just today suggesting that in a very small number of children, also severe symptoms as well that were previously recognized as being related to COVID. So some updates for the School of Public Health and the University of Washington more generally. So as I mentioned, an email just went out today for myself and Vice Dean Jared Baton to all SPH faculty and staff with updates about new restrictions on hiring. Those restrictions are in place because of concerns about financial issues related to the state. So it's not because we're in an immediate budget crisis right now, but more that we are trying to be cognizant that the financial prognosis for the state and the economy overall don't look super good right now. And so we're trying to be very careful about not taking on additional financial burdens at this time. So just as a reminder of those, I'm happy to come back to them during the Q&A period towards the end. But there are two parts of that restrictions on hiring. The first one is a restriction on hiring non-essential staff. And if you have questions about that, for instance, like what constitutes an essential staff member, like what might be an exception to that, then you should definitely talk to your HR manager, but we also have Megan here to answer some questions. And then also new restrictions on faculty hiring that will be in place through the upcoming academic year. The message that we sent out lists the great positions that we've been able to hire in the last year. One of those is Marissa. And we're in a very good place heading into this period of restricted hiring. But I wanted to make sure that people were aware that the hiring plan that we'll put forward to the provost for the upcoming academic year is going to be a lot smaller than our hiring plans have been in recent years. And that you should expect that we're probably only going to see 1 or 2 positions being advertised in each of our departments, if that. So we still need the provost to approve those plans. So I know that's different from what people had been anticipating and what we had been hoping for even just a couple months ago. So I wanted to make sure that we're being transparent with you guys and that you're aware of that going on. We have an upcoming town hall with President Kause on May 1st at 11 a.m. I'm going to be joining her along with the provost, Denzel Sweet, and Joe James, who's chair of the Faculty Senate, to answer questions from UW students, staff, and faculty. We're also expecting a number of prospective students and their parents on there as well. Betty Beckamar and the Northwest Center for Public Health Practice just received a grant from the Kansas Health Foundation to rapidly develop an online training module for contact tracing for COVID-19. That's based on the SEAL team curriculum that you heard about last week. So we're super excited about that and expect that to be a big part of both our states and other states' move to try and rapidly increase the number of individuals who are available who can do contact tracing as part of the pandemic response during the next phase. Some really good news that has nothing to do with COVID-19. Ali Rohani-Rakhbar, who's an associate professor of epidemiology, we just found out has been named as a recipient of the UW's prestigious Distinguished Teaching Award. That's only one of 7 faculty across the entire University of Washington to receive that award this year. So woohoo, yay for Ali. And there's a feature about that on EPI's homepage. And also this year, the UW Alumni Association awarded Patty Hayes, who's Director of Public Health, Seattle and King County, and a graduate of the School of Nursing, with one of our Distinguished Alumni Awards. So we're super happy about that. That actually was submitted pre-COVID, I believe, but certainly now more than ever, we really appreciate everything that Patty does to keep everyone in King County safe and healthy, in addition to just running a great organization. And kudos to you and everyone who works with you for the great work that you're doing. And a little bit of a heads up, I can't tell you the names yet, but the Husky 100 award winners are going to be officially announced next week. And when that happens, you will see that 9 SPH students have been named to the Husky 100, which is really great, and we're really proud of them. So you'll hear more about that than the particulars next week. Okay, so at this point, I'm going to introduce Marissa in a little bit more detail and then turn it over to her. So as I mentioned, Marissa is an assistant professor in DEOHS and serves as the program director for the Industrial Hygiene Training Program at the Northwest Center for Occupational Health and Safety, which is an important training grant that we have here in the school that's funded by NIOSH. We have one of their education and research centers, and training industrial hygienists is a super important part of that role. Dr. Baker's research has mostly focused on exposure to manganese in welders, shipyard, and foundry workers. She received her PhD in DEOHS in 2017 and was honored as outstanding PhD student that year. And she received a competitive F31 fellowship from NIEHS, and also was awarded the award for Young Exposure Scientists from the International Society for Exposure Scientists. We're super happy to have her with us. She's been doing some great work related to COVID-19 and how to keep our workers safe. So as we're all thinking about returning to work, we turn to you, Marissa, and we want to hear about what you're doing, and hopefully you can give us some pointers in terms of what we should be thinking about in the coming weeks and months.
Yeah, excellent. So it's wonderful to be here. This is a really exciting time to be in occupational health. You know, the workplace is really central to a lot of the challenges that we are currently dealing with and looking to meet related to COVID-19. Remember, this started in a workplace. An open air market in China is a workplace. And it continues to be fought in workplaces, in both hospitals and in research laboratories. So it really is as if we needed another reminder. It's just a really tangible reminder of how important occupational health is to public health and the importance of the workplace kind of as a place for interventions, for public health interventions. So one thing that I spend a lot of time thinking about is how can we characterize how many workers have actually caught COVID-19 at work? And, you know, to follow that up, how many workers have died due to workplace transmission of COVID-19? Unfortunately, this is a challenging question to answer. Some unions do a wonderful job of kind of collating that data at their union, and so we're able to have facts like at least 40 grocery store workers have died due to COVID-19. At least 80 transit operators, so bus drivers or subway operators, have died due to COVID-19. However, it's, you know, we don't know, that may only track the numbers who are in those unions, and that number is, of course, rapidly changing. However, I think this is a very important, you know, stark reminder that folks who are doing these kind of what we are calling essential jobs are at a much higher risk of exposure and then resultantly developing disease and possible death. The CDC has put out some guidance as to the number of healthcare workers who have, you know, had a confirmed case of COVID-19. They put out data for between February 12th and April 9th. About 9,200 healthcare personnel had a confirmed case of COVID-19. And more than half of those workers, 55%, reported only having contact with COVID-19 patients within the healthcare setting. So a very clear workplace illness. About 73% of the workers were women. And this is something that we've seen, that the majority of workers in these essential jobs that are still occurring are women, especially in healthcare, education, personal services, so, you know, in care, in-home aides. And the median age of those infected across the healthcare industry was 42 years old. So just another kind of reminder that COVID can and does affect workers of all ages. And there's an estimate from CDC that 11% of the cases of COVID in the United States are healthcare workers. So a reminder of kind of the burden that this pandemic is taking on the working population. So I have kind of, in the early days of COVID-19, I kind of turned to data to try to make sense of who is most at risk for not only exposure to COVID-19, but also kind of some of the secondary effects related to not being able to work or having like pretty drastically changed work environments. So I use data that the Bureau of Labor Statistics collects. It's called ONET. It's a really fascinating data source. I would encourage you all to check it out. So the purpose of this data source is for people who are interested in researching a job or maybe taking a new job. And you can go to the ONET database and look up an occupation, and there's about 900 occupations that are recognized by the Department of Labor that are included in this database. And you can look at all sorts of different metrics. You know, how often do you use a computer? How often do you work around people? Are you exposed to noise? And so it's not only exposures, but types of skills you may need and kind of structural characteristics of the job. There are probably 60 or 70 different metrics that are tallied across occupations. And this was, this has been ongoing for many years. This was not done in relation to COVID-19 or due to COVID-19, but it is a very rich data source. And there are a couple important things about this data source. They update it annually. Not all the occupations, but they update a subset annually. They also ensure that they're getting a representative sample from across the United States, from both small and large occupations, from different parts of the country, private versus not-for-profit, and some kind of stratified sampling to account for differences there might be in race and ethnicity and wage and such. So it is a fairly representative set of data. So there were a couple metrics I was interested in. The one was exposure to disease or infection at work. And so, I really just looked at which occupations report being exposed to exposure or report being exposed to disease or infection at work most frequently. Now, again, this was taken before COVID-19. And I think that we can all say that having gone through or going through this pandemic, we've all learned a lot of ways that you can be exposed and that we are all exposed, whenever we leave our houses in ways that maybe we hadn't thought about before in terms of infectious disease. But based on these data that about 20% of the workforce is already reports being exposed to disease or infection at least once a month at work. And about half that, 10%, reports being exposed at least weekly. Not a surprise, healthcare kind of dominates those workers, but also protective services. So firefighters, police officers, correctional officers, which we know is an important as we kind of try to struggle with how to protect our inmates. And also preschool and daycare teachers report being exposed to disease and infection, and also a lot in personal care. So social workers, counselors, people who work with more at-risk populations. So even though I'm telling you this and you're probably thinking, oh yeah, that makes sense. But it's really, we had never kind of done it in a methodical way and written it down and actually quantified what those occupations are. And there were some that were surprising that I hadn't thought of, even with my training in industrial hygiene. So, like embalmers and coroners and people who work with sewage, are some other occupations that it's like, oh yeah, they probably could have increased risk. So that's kind of the first project I did. The second project that I did using the same ONET data was trying to characterize who can actually work from home. And that was brought about because once, early on, we started getting the public health guidance of work from home, if you can, if you're able, work from home. And then workplaces kind of started closing down voluntarily, and then all non-essential workplaces got closed. So it seemed really timely to kind of look at who's still going to work. And so I looked at two metrics from the ONET database, the kind of ability to use a computer at home or the ability to use a computer at work, and how much your work involves interfacing with the public, with the idea being that people who use a computer frequently and don't interface with the public too much are going to be, most likely able to work from home. This is actually only 25% of the United States workforce. And it's kind of unsurprising. These tend to be higher paid workers in, finance, computers, administrative, engineering, technology, math, those types of jobs. And so these are, tend to be higher paid, likely male dominated, largely white dominated, and, they're able to work from home. So of course, every single worker, every single person is affected by the COVID-19 pandemic. And I don't want to, by focusing on the other workers, not acknowledge the real experiences that we're all having. And those are real feelings that we should be, we should be comfortable expressing. That just because I can work from home, doesn't mean that it's a walk in the park for anybody, but it is, there are other occupations that, we need to maybe think about how we protect them. And so for those occupations that cannot work from home, so 75% of the workforce, they kind of fall into two main buckets, I think. So one bucket is those who are essential workers, those who will continue going to work. Healthcare, of course, grocery store workers, those in driving buses, the postal workers. And so they are at risk of increased exposure just because they're out and about, they're interacting with workers, they're interacting with people, maybe they're taking public transportation, maybe they're carpooling with a neighbor. So those are kind of, their jobs might be secure, but they also have a lot increased exposure. Also, if those people, have families at home, they may not be able to see their families. So there's definitely some, stress and mental health concerns for these workers. The other group of workers are the workers who are not in essential services, but, can't really do their job from home. And so they're likely going to face job insecurity, layoffs, furloughs, and the numbers that, Dean Godwin gave us on unemployment kind of show that this is the case. Lots of people are being laid off, lots of people are job insecure and being displaced from work. And these actually are the lowest income workers in my data, a full, on average, $30,000 less per year than those workers who can work from home on a national average. And these are workers in grocery store, or these are workers in like the food service, and also who work at small retail, a lot of personal services. So, masseuse, people who cut hair, these types of jobs. So not very high paid, maybe no employer-sponsored health care, maybe no union protections, so it can, and might be some of the last jobs to kind of pick back up as we start thinking about opening up some aspects of the economy. So that's kind of some of what I've been working on, and I'm happy to answer questions about that if people have them. But I also kind of wanted to talk a little bit on my thoughts for returning to work. Governor Inslee has, opened up light construction to start here soon, and a lot of other businesses are antsy, to get their workers back to work. And this is, really an unprecedented time. And for the most part, we're trying to figure out as we go along. If you've gone to a grocery store over the past, couple months, you've probably noticed that every time you go, something is different. Like it started, there was just a plexiglass screen. Then they added in maybe lane demarcations. Now they're having people queue outside the store and only letting a certain number in. And just yesterday, Costco announced that starting May 4th, you won't be able to shop at their store at all unless you have a mask on. So both the shoppers and the workers. So, and this is kind of a good example of, I think, what we're going to be seeing as we start opening up the economy is that things are going to change rapidly. Workplaces are going to try to keep responding to best available science and, guidance that they are given from either the state or their internal health and safety folks or, whoever, wherever they get their information. And so there's not really going to be any kind of consistency for a while. And I think that, as we move to opening up construction, that might kind of be the first test case of what's working, what's not, how can we adapt, and what can we change to make this happen. And Jay Inslee released a very comprehensive 30-point plan for construction to resume. It's very comprehensive. It's very thoughtfand it was obviously informed by members of the construction trades and occupational hygiene practitioners and experts. I've read it. I don't have any, it's excellent. They've thought about a lot of things, but I am eager to see how it actually plays out. Construction is a complicated industry. Coordinating safety on and across construction sites has always been a challenge. In Governor Inslee's plan, he kind of puts the responsibility with the general contractor, but there may be multiple trades working on the same site. They may be getting their health and safety information from, their union or their health and safety person. There could be subcontractors. So it's always been a challenge to kind of have consistent health and safety across a construction site. In this plan, it does ask for there to be one person on site kind of designated as the COVID-19 expert and enforcer, for lack of a better term. And so hopefully that is something that, maybe that's something that will continue in perpetuity with each construction site having kind of a coordinated health and safety plan instead of kind of the piecemeal that we've been seeing. And also I think that, while there's a lot of great, Governor Inslee outlines, a very comprehensive set of controls that need to occur. Some of them, it's like, well, let's see how those play out in practice. For example, often construction workers are doing tasks that require an N95. And if there's a shortage of those, are they going to then compromise and use a lower protection mask, and then be at increased risk of a different exposure, not necessarily COVID-19, but maybe a dust exposure. So, that's a consideration. Things like, so if they can't access PPE, or if, they're using disinfecting products, but they maybe haven't been trained on how to properly use them. And so they're just getting sprayed everywhere at all times. And so again, you're kind of introducing another exposure from the cleaning agents, on top of potential COVID-19. So I've kind of made a list of some areas that I think workplaces need to think about including, and not just workplaces, but also, places where we study, where we congregate together, where we might go to an event. And excited, I've seen many plans that workplaces have started putting together and other organizations. And these are things that, people are thinking about. These are included in the construction plan, but you really can't come up with a one-size-fits-all return to work plan. So kind of thinking through some of these topics and how they apply to your specific, workplace. So first kind of is cleaning. Are you using an appropriate cleaner and spraying an appropriate amount? Do you know what that is? How do you know when and how frequently you actually need to be doing so, such that you're not introducing additional exposures? PPE, as I mentioned, do you have access to what you need? And are people not wearing more than they need? If we have people who don't need to be wearing an N95 and they are, it's probably best for them to downgrade so we can get those N95 to our healthcare workers. But if they need one, then let's ensure that they can get one to do their job. Social distancing, how can you create a workplace that basically requires people to be socially distant? Can you stagger your start and end times and also your lunches and breaks? And this is something in Governor Inslee's plan. Basically, what protections can the workplace put in to discourage people from congregating? Can you close particular workstations? Things like that. Worker hygiene. Are there places for workers to wash their hands and the opportunity to do so frequently? You think of at some construction manufacturing sites, it's like they might have a porta potty. And if people don't really want to use those hand washing facilities because it's gross, they're not going to. So can we, and work sites are required to have water for workers to wash their hands. can we, another way to have hand washing facilities that people are comfortable with, and, have some like mandated breaks for people to make sure they go wash their hands and don't feel like they're being penalized if they're away from their workstation to go do so. And also the workplace needs to have a clear idea of what steps they're taking to ensure sick employees are not coming to work. This isn't just health screening, because we know that you could be, asymptomatic and still infected, but they need to make sure that they have policies in place where workers know that if they or a family member is sick, that they do not have to come to work. They will not be pissed. This, I frequently hear like, well, I wanted to take sick leave, but my boss said if I'm not going to be there, I have to find someone to cover my shift. And that's just not going to cut it. That's not going to encourage people to actually take advantage of sick time if there's this perceived barrier to its use. So workplaces need to think about not only screening employees, but also, kind of maybe like they send them a text message every morning that's like, have you been in contact with anyone who has these symptoms? So we're thinking a little more broadly than just a temperature check. Also, does the workplace have a mean for concerns and suggestions to meaningfully be raised by workers? The last thing we want are workers who are afraid to be at work. If they have concerns, they are worth being listened to. Early in COVID-19, several bus drivers raised concerns about how they did not feel safe on their routes. And it took a little bit of time before they were actually able to get these addressed. Like they wanted masks early, they wanted to be able to shut down the front doors. So I think we've learned that, let's take these seriously early and, really listening meaningfully to what the workers are saying. And does the workplace have a mechanism for communicating evidence-based information to workers in appropriate modalities, in appropriate languages, and adapting to any kind of best available science? So be able to get in touch with your workers to let them know what they should be doing. Does the workplace have up-to-date information on things like unemployment policies in the state, sick leave in the state, FEMLA, to pass along to the employees when it comes up? We don't want these employees feeling like I can't come to work, or I got laid off and I don't know what to do. Like they need someone to help, kind of organize that. Do employees have access to healthcare, including mental health care? Is a big one, I think, as we return to work. Are there policies established to support workers who may be home with children and make it kind of hard for them to work a standard schedule? And then, how does the site or the workplace handle visitors or interactions with the public that are occurring? So, a lot of this is covered in Governor Inslee's plan. Some of them related to, access to health care and policies to support workers who might be home with kids, are a little more, broader public health. But I'm thinking that let's start thinking about these now, and then when we are past COVID-19, let's keep it all. Let's keep the good that maybe we can get from this. So that's kind of my spiel about what I'm doing and seeing. If there are any questions, I would love to take them. Is it okay for me to look?
I see. Yeah, absolutely, in the Q&A. So there's one from Jim Glendino who's asked, from OneNet data, did you find that primary, secondary, and post-high school teachers would be classified as able to work from home based on the metrics you used?
Great question. And this is actually one that I am, I can tell you definitively the answer to this. So primary and secondary teachers ended up in the quadrant that interaction with the public is important, and so is use of a computer. So they ended up in a bucket that is challenging to work from home. But the post-secondary teachers, such as myself and many others on this call, ended up in the bucket of able to work from home. Computer use is very important. Interaction with the public is minimal. Yes. And then the anonymous attendee asked, Dr. Baker, please discuss the recent executive order regarding reopening of meat processing facilities and what the role of UW is in such circumstances moving. So I am honestly not familiar with the executive order, the reopening of meat processing facilities. But I will say that, you know, this is seen as, this is an essential part of our food supply chain. And, you know, people are really wanting to make sure that we have access to food. In terms of the role of UW faculty, students, and researchers, I think that our role there is kind of the same as it could be with any other industry or occupation opening up. And that is, if we are, you know, called upon to kind of help develop and think about best practices, you know, we need to do so likely not being able to see the workplace. And so that's why I kind of presented these ideas broadly. So kind of have a conversation with a representative at the workplace, like, have you thought about these things? How are you going to do it? And ask the probing questions, you know, to ensure, okay, you have a sick leave plan, but what if somebody takes it? How does that affect the, you know, are they then told they need someone to fill their shift? Are they penalized in any way? And so, you know, so I think kind of the role of UW through this is to kind of make sure that we are asking the right questions and, you know, really making sure that we are giving the best available knowledge. And we are really lucky to have a super strong state workers' health and safety plan through our Washington State Department of Labor and Industries. And they really have been on the ball with new guidance specific to different occupations, frequently updated. You know, I go on and it's like, oh, a new update for grocery workers, a new update for construction and meat processing and fishing. So, you know, so I think it's kind of to just make sure that we are, we know how we can help. We don't overpromise. We don't, you know, try to contradict what Labor and Industries is doing. And then another question from Dr. Guadino. In states going back to work now, Iowa and I think Texas will not allow workers in industries opening up to be ineligible for unemployment insurance if they are afraid or at risk for COVID-19 exposure. Is Washington State doing this differently per the governor's plan? I am not sure what Washington is doing in regard to unemployment, those specifics, unfortunately. If there is someone on the call who does, on the panel.
Yeah, I don't know the answer to that either.
So one like just kind of snippet about unemployment is that, if you are unemployed, you need to be able and willing to work. And so the one tricky instance that I've seen play out or that I've heard about is that if you're unemployed and you're like, well, I need to be home to take care of my child, you technically don't qualify for unemployment. That's considered a family leave situation, because if you're taking care of a child, you're not ready and willing and able to work. So that's a good question, Dr. Guadino. I also received a question. What are your thoughts on the roles of unions in terms of preventing COVID-19 spread for essential workers? So unions have a long history of improving health and safety outcomes for workers in this country. I would love to see more workers using this opportunity to organize, quite honestly. Like, let's get our delivery drivers organizing. Let's get our Amazon fulfillment center workers organizing to kind of secure those rights going forward, because we know that that will lead to increased health and safety, better pay, you know, better benefits, and ultimately better health for these workers. And the unions are, you know, during this, I've been working some with the bus drivers union and also the Teamsters, who represent our app-based drivers, so our Uber and Lyft drivers. And they are on top of it. They are, helping these workers navigate unemployment and navigate sick leave. They are advocating for, PPE and additional workplace policies. They are coming up with creative solutions for workers who may be out of work. So yeah, the unions are essential for essential workers, I think.
Okay, any other questions for Dr. Baker? All righty, thank you so much. Something else come up?
One more.
We got another one for you.
So what other immediate research and policy work are you identifying that needs to be done currently? So yes, one thing that I think we need to think about are these app-based drivers. So here in Washington is one place where they are actually represented by a union, which is awesome. You may not be aware that there are actually 30,000 app-based drivers registered in King County, Washington. That is an incredible number. For comparison, we have just under 5,000 bus drivers in King County. So a large, group of workers. And there are definitely some concerns that, they have. They're in this position where they really need to be working because of monetary, and they're allowed to be working under the, current orders, but a lot of people just understandably are afraid to get in an Uber and take them. So I think that, given that they're often immigrant or refugee workers, we need to make sure that they are getting the messaging in their native language in an accessible format. So that's kind of one area that I see. I also want to mention a survey that we are starting. I'm starting with Mark Boudreau. He's a certified industrial hygienist and a staff member in DEOHS, and it's a business impact survey. So really trying to reach small businesses across Washington, Oregon, Idaho, and Alaska to understand what are their concerns as they start trying to, reopen their workplace. And what are some controls that maybe they've used that we haven't even thought about that could be of benefit to other companies? So that could be something that I think we'll learn a lot about what businesses are doing, what their concerns are, and then, as researchers, students, we can kind of hopefully help to fill in some of those gaps with, here's what we can suggest. And yes, I would love to share the link to the survey. I will have Jeff, if he's able, to put it in the digest, if that's okay with everybody.
Yeah, of course. Yeah, as you were saying that, it reminded me one question that I've heard coming up lately is questions about the utility or effectiveness of plexiglass barriers in different workplace settings, and concerns that when people are have those plexiglass barriers, that they're not using masks as frequently, or that they're not washing their hands as frequently, so that they're sort of, that it's just not intentionally, but it sort of discourages people from probably the more effective interventions. Have you looked at that at all, or do you have any thoughts about that from an IH perspective?
That's a very good point. That and that was kind of some of the concern around masks initially too, was that, if someone's wearing a mask, they're going to feel, like, oh, I'm in a mask, so I can get as close as I want to people, and or I'm in gloves, I can do whatever I want. I have not been able to find, and I have looked any like actual guidance about like how big should these plexiglass screens be, how frequently should they be cleaned, how thick should they be, and so I do feel like it was a somewhat of a, I'm going to say a reactive control. That doesn't mean that it's bad or that it doesn't have utility, just that it was kind of like, well, we need to do something, and this is doable and feasible. You know, and especially if it's in response to employee concerns, then, you know, there is some value in that, you know, the employees are feeling heard and empowered. But yes, I have not seen any research coming out yet. I am not working on that. But that could be a pretty interesting opportunity for a research question. I am starting to do a little research study with an industrial hygiene master student looking at grocery store controls between 2 US cities in both lower income and higher income neighborhoods to kind of see what do grocery stores have and how is it changing over time. So
that sounds great. Well, I look forward to hearing the results of those studies. And thank you so much for joining us today.
Yes,
it's been super interesting, super helpful. So thank you.
Oh, yes.
Okay. So, okay, that was the last question. Okay, so I'm going to turn it over to some of our other panelists before answering the Q&A stuff that's linked up. Janet, do you have any practice updates for us?
Hello. Sure. So I think I'll start with some campus related things that you teed up, just kind of how we're being helpful as a school. So Hilary, you mentioned this contact tracing training that the Northwest Center and the SEAL team are working on together, which is really exciting and will be a great contribution. I also wanted to give a shout out to our Department of Biostatistics, who has been helping and advising some of our Department of Health partners, and I've been hearing really terrific things about how helpful they've been. The SEALs continue to be supporting our campus environmental health and safety group, the kind of public health agency of our campus. We've been asked to help out with doing some quality control of the case investigation processes at the state. This just came up recently. And then also within the last week, we were asked to help out with a Department of Corrections consultant who's working on setting some testing recommendations for jail populations, which is also a really terrific opportunity for us to contribute. As far as the work of the public health agencies, so, you know, I think everybody kind of is aware we're transitioning into a new phase. And I guess what I'll say is that everybody is working really hard right now to get those processes in place for the coming phases, including plans for testing and all the contact tracing we've been hearing about, and how to kind of do ongoing monitoring of how everything is going over time as we start to do this, you know, transition to a slow reopening. And I wish there were more details I could provide you with on what those plans look like, but it really is very active right now within the public health agencies.
All righty, thank you. Stephanie, do you have any updates for us related to classroom stuff?
Yeah, no, I don't really have anything new in the past week, except that we have completed many of the mid-course evaluations. Instructors have the feedback specifically about how engaged students are with the course material and whether or not they feel like they're engaged with their instructors and their fellow peers. So we received a lot of good input and suggestions through those mid-course evaluations. I'm really grateful that Central Campus helped organize those. And then most of the other questions, honestly, from students are related to hiring and career options post or mid-COVID. So I think that fits with your Q&A that we're teeing up here, Hilary.
One thing I did hear from my Dean's Advisory Council of Students, which you're just reminding me that I promised them that I would bring up, is that because of like the power differentials in the classroom, they often feel nervous about, you know, all of us need to step away from Zoom periodically, particularly when we're there for hours and hours for bathroom breaks or to get a cup of tea or a cup of coffee. And so just to sort of remind faculty to please make sure that you're messaging to your students that you understand that they do need to, you want them there online because you want obviously to be making the connection and know that they're actively engaged, but also making sure that you're messaging that it's okay for them to, you know, turn it off for a few minutes here and there to go take a bio break. So
yeah,
that was one
absolutely.
request that I got.
Actually, I appreciate that. I actually talked to an instructor today who mentioned that every 10 or 15 minutes they have an activity break. So they stand up, they stretch, they move around, which I thought was a really interesting idea. I've also heard that students feel uncomfortable with the camera, which is very strange to be talking into a camera, computer screen all day long. I absolutely get that. So just reminding instructors that there are all sorts of ways to engage students with or without their videos on. For example, the chat box is a great way to ask a question and have them very quickly drop something into a chat box, or polls or breakout rooms. So there are a lot of ways to keep students engaged with the material and with the instructors and their fellow peers. It doesn't necessarily have to be with the video screen on and having a conversation that way.
Yeah, you reminded me, I did also hear from students, the discomfort of the screen, and also I think, you know, the younger generation is much more used to looking good on screen, you know, like, you know, this is the generation of people who know how to pose, right, for selfies and all that kind of stuff. And so I did hear some of them also saying that they're not super comfortable with, you know, I might not be looking so great today. And I was like, your instructors don't care about that, but I don't think they care about us. I think they care about their peers. So anyway, just to be flexible, understand that not everyone wants to be like on screen and visible all the time. So
yeah. Oh, I already told you that I threw a scarf on so I could cover up my sweatshirt. So I get it. Thanks.
But she looks very glamorous, so it's okay. Okay, so Juanita, any updates about stuff related to commencement, graduation?
Thank you. Sorry, notes about graduation should be coming out this week. We are excited that we have partnered with the UW commencement, and students will register through that profile and get to participate in our ceremony. I think the thing that we're most excited about is we have our registration will be sending programs to students at your home, so hopefully you can enjoy the program as you go through our live ceremony, and that we are inviting all of our 2020 graduates back for 2021. We hope to have an idea of the population that'll be attending so we can think about how to suitably congratulate and celebrate at that time.
Great. Okay. And last but not least, Lisa, any research updates?
Yes, I have just a few. The Population Health Initiative COVID-19 Rapid Response Grant Review is completed, but they have not yet announced the awardees. That is expected to happen toward the end of this week or early next week. So keep your eyes peeled for that. There were lots of really exciting applications that went in, and lots of them from our school. There's also been a lot of other COVID-19 related grant applications that are being submitted by our researchers. Lisa Brown in the Dean's office, who tracks all of the applications that go through, tallied them today and told me that as of today, we've had 30 COVID-19 related proposals that involve School of Public Health researchers, either as PI or as a co-investigator, already have been submitted. So that's really exciting news. And more exciting is that we're beginning to see some of the applications to foundations are already being awarded, and research is getting up and running. The UW Office of Research is continuing to work on the framework for determining when we can resume some of our research activities and how. This is being coordinated with a larger campus master plan for gradually returning to activities. And so We expect that these plans will probably be released in parallel, and those should be forthcoming relatively soon. Related to that, however, we're all very excited about the approaching May 4th date, which signals the end of Governor Inslee's initial stay home, stay healthy order. But Human Subjects Division this week did issue an updated announcement reminding people that the temporary halt to in-person research that was instituted for the end of March is unlikely to end on May 4th. So they are advising that all researchers should assume that this temporary halt remains in effect until we hear otherwise. And of course, these decisions will be made based on guidance from our public health authorities and the campus at large. So I think that's it. Lots of exciting new proposals and COVID-19 related projects going on, and new things being funded.
Great, thank you. Okay, so we still have some open Q&As, and I know Megan answered some of the hiring related ones individually, but I want to make sure that we go through them as a group, just because usually when one person asks those questions, a lot of people have the same questions. So I'll start with the ones that are still up here, and then we'll swing back to those ones that Megan had handled on an individual basis. So, so the first one was, besides restrictions for new hiring, are there any budget concerns that could imply layoff of current staff or faculty? So the answer to that is that we are not at this point having those conversations. That really, as I mentioned, it's not that we have an immediate right now budget crisis. We actually had really good enrollments, or have really good enrollments for spring quarter in the School of Public Health, up a little bit this spring compared to last spring, which is great, where some units saw decreased enrollments, not surprisingly. So from that perspective, we're looking pretty good. We're also, we have a lot of new grant money coming in. So that stream of resources is also looking pretty good. So no, we are not having those conversations at this point. The idea behind the restrictions in terms of hiring staff and faculty is really a proactive one to make sure that we're not taking on additional financial obligations that aren't essential, you know, as given all the economic indicators that we have that suggest that the state will likely be enacting budget cuts going forward, and that you know, the global economic outlook does not look good. So at this point, we're really trying to sort of just constrain our obligations going forward, and we're not talking about layoffs at this point. Okay, I got a question about antibody testing. So apparently staff received an email today saying that the University of Washington will offer employees antibody tests, which I guess it noted was, according to this, was optional and would first be piloted with staff directly working with COVID patients. That makes sense. That would be the healthcare workers. And that question about employee privacy being protected, specifically whether or not employees will have the option to share the test results with their employers, or whether employers automatically know their test results. That's a great question. And I will try and find out specifically more information about this so that we can include it in the key takeaways. But let me sort of give you a little bit of a broader picture. So for antibody tests at this point, so you guys have probably heard a lot about the antibody tests in the news. Those are tests that can detect whether or not someone has had a prior, or they could have a current infection, but it would have to be pretty far along with COVID-19 to the extent that they've built up an immune response to it. What we don't know at this point is whether or not that confers immunity to a recurring new reinfection with COVID-19. So at this point, we, and I don't believe anyone in the state of Washington, but I could be wrong, is planning, we are not, let me say, at the University of Washington, we are not planning to use those antibody-based tests to make decisions about, for instance, who can return to work, because we have no scientific basis at this point for knowing whether or not those workers have some immunity to further infection. So given that, the reason, so you may be wondering, then why are we testing? And the reason that we're doing that, the testing for antibody levels, is so that we can get a better sense of what percentage of the population has previously been infected, particularly given that with this disease that there's a significant percentage of people who are asymptomatic and probably may not even know that they had COVID-19. So it's really for us to get sort of that population level data, get better data on that level. So given that, it would really surprise me if information about the results from that testing for individuals was released to, for instance, supervisors. That just doesn't make any sense. But I will double check and confirm for you on that. And you should feel free to push back on whoever it was that sent you that email and ask them, hey, what's it going to be used for? Conversely, testing that is on individuals to check to see whether or not they currently are infected, which would be PCR-based tests or antigen tests, which are the ones that have been more widespread up until now. So telling whether or not someone is currently infected with COVID-19. COVID-19 is a notifiable disease, and so that means that there are requirements in terms of reporting those results. And we also, at the university level, our EH&S team, supported by the SEALs, use that information to do contact tracing, to try and contact the people who might have been exposed and follow up with those folks, and if necessary, ask them to self-quarantine. There's information about who tests positive is given to people who need to be able to do that contact tracing. That doesn't mean that just anybody can have access to that information. But Janet, do you want to talk a little bit about privacy issues there, if you're still on?
Yeah, I'm still here.
Okay.
I guess that was a great answer. I guess the only thing I'll add is that, these diseases that end up on this national notifiable list, because they're called notifiable or also sometimes called reportable, it makes it sound like you can report, it's reportable, rather than it's like actually mandatory to do that reporting. So I just wanted to point out that it's the law that public health be informed of these conditions that are on those lists. It's not like anyway, the people who handle those data are very well trained to maintain confidentiality and use those data only for these public health purposes that Hilary is mentioning. So I just just wanted to kind of highlight that legal mandatory nature of this kind of reporting for those confirmed cases of illness.
Yeah, and sort of related to that, so the UW health system has been working on a way to be compliant with public health guidance about checking to make sure that you don't have workers coming on site who are sick or who have symptoms of COVID-19, while still maintaining people's privacy to the greatest extent possible. And the approach that they have taken is to use an attestation system in which individuals who are in UW, the health system, each day receive a text saying that they need to attest that they are symptom-free. And that's worded very carefully so that they don't have to say what their symptoms are, or anything like that. They just have to say either I'm symptom-free or I'm taking a sick day. we are in the process institutionally of coming up with a way to do that through Workday, and in a way that supervisors would get notified if you either hadn't completed your attestation or and showed up on campus, or if you opted to take a sick day, but they aren't going to get detailed information about any of your symptoms or any more than that. It's a really simple, very protective of the worker system. So expect to see stuff coming out about that. That's going to be an important part of our control measures that we have in place related to what Marissa was talking about earlier, and you'll see more information about it. Part of how we can make sure that as we start having more people return to work, as some of these restrictions get lifted, that we're still pretty confident that we're being protective of people's health. Okay. A question about whether there's been any communication regarding restricting travel between states and or outside the United States. We are still have in place, the Centers of Disease Control have a level 4 travel advisory for the entire rest of the world, which is that they are the states that US citizens and residents should not be traveling outside the United States at this time. And I have not heard anything about that being lifted. And if someone else knows otherwise, definitely feel free to pipe in or put it in the chat. In terms of travel between states, so we have asked that our folks not travel outside of the state for work-related activities, and as have other health science schools. And that will probably continue to be in place while we have stay home, stay healthy in place, although obviously we'll reassess depending upon local guidance that we get, and guidance from the governor's office. But I'm not aware of there being anything at the the federal government level about restricting travel. That's a pretty stringent thing for the federal government to put into place. And although there's occasionally been talk of it, I have not heard of anything recently. Jim points out, just so that we all know, and thank you for pointing this out because I did not know, that public health agencies cannot be forced to give names of reportable cases and can resist legal challenges. So bolstering Sarah Janet's assertion of there's good protections in place for folks that do have do end up having COVID and where it ends up getting reported. Okay, so, and Jeff Hodson asked me to remind you that under the COVID response website for the University of Washington, there's a section on travel that has answers to all those questions, and the link to that is in the chat section. Also, Jeff mentioned that while we were in the middle of our webinar, Governor Inslee announced new guidance for healthcare providers, giving them a little bit more leeway in having non-urgent surgeries, which should allow additional patients who've been waiting to get surgeries to have that done, and hopefully boost hospital revenue flow. He's been pretty clear about messaging that there has to be adequate PPE supplies in order to do that, but I know that's something that the hospitals have been really hoping for, so that's good news. And good news for anybody who needs something that's deemed non-emergency done and has been waiting for that. Okay, questions from earlier that Megan had addressed about hiring freeze. So one person asked whether the hiring, so first of all, it's not a hiring freeze. And I know it sounds like that may sound like semantics, but it's actually really important. So whereas other institutions have implemented hiring freezes, we are officially in a period of restricted hiring, which is an important differentiation because it explicitly acknowledges that there will be hiring that continues. So just as a concrete example, we have a lot of people who are bringing in new grants that are related to COVID-19 research. And so if they need to hire research staff in order to perform that work, that is possible still under these restricted hiring conditions. So we really do encourage you, if you have questions about whether your specific position or project meets the criteria as essential, that you talk to your unit or department level HR manager, or if you're still confused, feel free to reach out to Megan to check and see whether or not the situation that you're referring to is subject to the hiring restrictions or whether it would be an exception. Okay, so the question about whether it prevents renewing existing hourly appointments. She said that you should reach out to your unit or department HR manager so they can work with you to make sure that the position meets the criteria in order to extend or renew the hourly position. Another person asked, can you share guidance on hiring restrictions with students? Because they hadn't seen the memo. Some of them are, some students are looking, oh, right, yes. Because some of them are looking for jobs and want to know what types of opportunities may become available in the school. So Megan points out the current hiring restrictions apply to student hourlies, but not academic student employee or ASE positions such as RAs, PAs, and SAs. I will post on the chat section, or maybe if Megan's still on, she can post her response about the UWHR website where you can find out information about hiring for student hourlies that talks about what criteria positions need to meet. And she also provided her email address. So Megan, if you can move that to the chat section, that would be great. And then we received a question from someone saying that they want to know what types of staff positions can be filled under the new rules to help guide them in their job search. Can jobs that have previously been advertised be filled, or will further jobs be posted? What about positions funded by research grants? So the response there was departments and units are encouraged not to open new recruitments unless it meets one of the criteria. And again, we're going to post for you those links. I'm going to move it there right now. I think Megan might have had to go to another meeting. Okay, whoop. All panelists and attendees. Okay, here's the part for students. And then here's criteria. Okay, so there's the link in this most recent chat posting about criteria for what kinds of positions can be filled. If you've applied for a position that's still active on UW hires, you can reach out to UW Employment or to the department that posted it to inquire whether the position is still being filled. It's not necessarily that just because it was already posted that we're allowed to fill it. We're still subject to those criteria unless there was a cutoff date about April 10th, and at least for faculty positions, for offers that hadn't been made by April 10th, we had to receive additional approvals before being able to make offers. And something similar is true for staff. I don't know if Megan's still on. If she is, she can answer, but just because it's posted doesn't mean that we will be hiring. So you definitely need to check with the hiring unit or with UW Employment to find out the details for that specific position. Okay, whoops. Okay, we had someone ask about hourly student hires and as students graduate, if they're caring for animals, whether or not new students could be hired to replace those person who are graduating, if they're considered essential. That specific one, I do know the answer to, because certainly animal care is one of the essential categories. So if there were not alternatives of people who are available who were currently hired, that's a good case to be made. But again, really the best person to talk to about those specific cases is your departmental HR manager, who can help you walk through your specific situation. Okay, and Janet, we have one more question for you, which is, someone who asked, when do we think contact tracing will be largely implemented for King County Public Health?
Yeah, so when I was
The
talking
question
about,
of the day.
it's the question of at least a week, actually. Yeah.
Yeah.
So when I was referring to those processes that are still in the works at the state and the county level, this is one of the big ones that's under discussion right now. So, you know, implementation kind of requires the processes to be in place, and those are still under discussion as of last Friday, the last meeting that I was involved in with the state and the county. So it'll be a little while. I wish I could say when, but I don't know.
Okay. And do you guys have any sense of when the online training module will be available through the Northwest Center? Not like date, but like week?
A few weeks. Yeah, we just got started on it late last week.
Great. All righty. It looks like we have exhausted the Q&A section for people. I want to thank everybody for joining us, in particular Marissa for coming and being our special panelist today and providing us with all sorts of interesting insights into what she's doing, what she's seeing so far, things that we should all be thinking about as we start to hopefully be able to come back to campus in person. And for those of us who are supervisors, how to think about doing that in a way that keeps everyone as healthy as possible, and you know, respects the fact that people have a lot of different constraints going on right now, and that's going to be challenging. I did see, I'm not sure what happened with this, but I did get a question from Monet somewhere, but I don't know what happened to it, about sort of what, whether people were wanted to discuss issues that they're having in terms of challenges in terms of getting research done. So I'll talk about that, Monet, with Lisa, but if people have suggestions about a forum for that, if people, I don't know what would be most helpful, you know, that the unfortunate reality for many of us is that it's really hard to get some parts of our work done, and I'm sure for some people more so than others during this time. And that can be super frustrating particularly for academics who are used to being able to control more of, you know, their work schedule and their progress, and tend to be pretty self-directed and driven. So having, you know, life, COVID get in the way of everything is super frustrating and super hard. And I don't want to diminish that. I know that people are really struggling with that. So if you guys have suggestions of things that you would like to see in terms of future topics that you want us to cover, about panels or other things that we could do, or mechanisms where people get to talk a little bit more, we're totally open to those. Feel free to email me directly. I'm hgodwin@uw.edu. Lisa, did you want to say anything?
I just want to echo that. I would also love to hear about challenges that people are having. And I look forward to brainstorming with Hilary about some kind of forum that we could put together for this.
Yeah, Okay, great. So thank you all. Please do, as soon as we're allowed to, get out there and enjoy the parks. It's an exciting development, particularly here in the Pacific Northwest, where we have such great natural resources. Looking forward to enjoying those, and I hope you guys get out there too. And with that, I will see you guys next week. Bye.